Colorado, Mr. Tipton, for 5 minutes.
Thank you, Mr. Speaker. Mr. Speaker, there are probably very few issues that touch Americans, families, our states, small businesses, more personally than health care. This House has dealt numerous times with addressing the Affordable Care Act. But when we talk about it on that very personal level, of a mom taking a sick child down to visit the doctor, to a senior citizen that's counting on that hospital being able to be there, to be able to deliver the care that they need. We need to recognize that the overarching view that Washington typically performs when passing a bill and delivering it to the American people, that it has very real consequences, very real impacts. In my district in rural Colorado, and in fact throughout rural America, there is a looming healthcare crisis that is just on the horizon. That ability to be able to go to the doctor, to be able to have a hospital that's going to be there to be able to provide the service that's necessary. They're feeling that real impact right now at home. We've had a lot of discussion about that big overarching bill, the IPAB boards that are going to be making the medical choices for our senior citizens, indeed for all Americans, rather than that choice being made between the doctor and the patient, about the state mandates that are coming through, the Medicare payment cuts, higher health costs, the budget that is now going to be estimated at $1,760 billion in cost over a 10-year period, and rising on a struggling American economy, on struggling families and small businesses. The 150 new boards that are being established, the better than 12,000 pages of new regulations that our hospitals, our doctors, our families are going to have to be dealing with. And the short form to simply be able to fill out and to be able to apply for the Affordable Care Act, 21 pages just to be able to get insurance. We need, Mr. Speaker, to be talking about those real impacts, not from the 30,000-foot view, but on the ground at home. I recently went to Delta Memorial Hospital in my district, a small community hospital that's proud of their service. In fact, they've had multiple surveys that went through and rated their service among the best. They're now being challenged by the Affordable Care Act in terms of that health care delivery. We have a program called the Recovery Audit Contracts, conducted by individual companies that don't even have to have healthcare background, that are going back in and reassessing costs, and they're having to pay back money now, money that they simply do not have. We're seeing reimbursements to doctors drop at Delta Memorial Hospital, making it harder for the physicians to be able to deliver that service. These are small hospitals. They don't have big HR departments. They're there for the health of the community. But they are seeing real challenges in being able to continue, and in fact, in many of our rural hospitals, they're beginning to wonder if they're going to be able to continue to deliver that service. I've talked to doctors in Delta, Montrose, Grand Junction, Pueblo, throughout my entire district, who are frustrated that they are now seeing their reimbursements, money that they need to be able to conduct their business, being cut by the federal government determining what the value of that service is going to be and saying you can simply afford it. That's not real life. And what we are seeing now are senior citizens who just became senior citizens by the virtue of a birthday over the last few months. They cannot find a doctor who is willing to take Medicare simply because they can no longer afford it. We have a system, Mr. Speaker, that completely forgot the original premise that every American, I believe, can agree on. We need to have real reform, but we need to go back to that initial premise of affordability and accessibility. The Affordable Care Act fails on both levels. We are seeing right now in my home state of Colorado, estimates for individual insurance policies this year are going to go up an estimated 23% or more. For small businesses who are trying to provide group insurance, they are seeing their costs going up this year, estimated better than 17%. Have we achieved more affordability as was promised? We have not. When we're talking about that accessibility issue, when that senior citizen in Delta, Colorado walks into a doctor's office and is told that they aren't accepting any new patients, are we achieving that accessibility? We are not. Mr. Speaker, we need to go back to that original premise, because so many small businesses right now that would like to be able to deliver that service are feeling the impact. I have a friend who owns several small Pizza Huts throughout the West, and she is dealing with those additional costs that are hurting her business and her ability to be able to deliver that real service for her employees. We have a challenge in this country, Mr. Speaker, and it can and will be addressed if we will go back to that original premise of affordability and accessibility. The Affordable Care Act fails on both points. Let's roll up our sleeves and get the job done for the American people. And with that,